Hello, everyone. You are welcome to the Oluwatoyin Ibironke Durojaiye Social Talk Series. We really want to appreciate everyone for always being there. We appreciate all our subscribers. Thank you for your support. In a short while, we're going to be putting out our bank details for those who want to support the foundation. But for those who have been supporting us morally, for all our guests, we say thank you so much. We have a guest in the house, and I'm going to leave her to introduce herself. Thank you so much for being here for us today. Let the audience meet you.
Okay. Hello, everybody. I am Folarin Wuraola. I am a registered nurse, a registered midwife, most importantly, a lover of God, and I'm also a writer. So it's a privilege to be here. It's an honor to be a speaker in the Great Foundation. Thank you so much.
Thank you. So today we have a very, very important topic. We have a topic that is current. We have a topic that has impact in many homes, and that is cervical cancer. Our specialist, Auntie Folarin, will be giving us a presentation on cervical cancer. Over to you.
All right, ma. Thank you very much, ma, for the privilege. So today I'll be creating awareness on cervical cancer. And this awareness talk is not just to women, it is also to young girls, it's also to teenagers, even to children, because I believe they will grow up to be young girls, they will grow up to be women later. So this is just creating awareness about cervical cancer among them to uphold their strength as women, and also for the health and prevention of cervical cancer. A woman's body is unique and powerful. I cannot even explain this enough, because women are very unique, from menstruation to menstrual pain, from ovulation pain, from labor to labor pain, then menopause, where they go through menopausal symptoms. Women go through a lot. Women are unique. Women are very powerful. But this uniqueness of women make them prone to some diseases. There are some diseases that threaten them due to their uniqueness. And one of the many diseases, because there are a lot of diseases that women are prone to, one of the many diseases is cervical cancer. And one thing about cervical cancer is that it is preventable. It is very preventable, and it is curable if detected early. And note, I said if it is detected early, because if it is not detected early, that's when you go through managing it and other things. So according to WHO in 2024, cervical cancer is the fourth most common cancer in women globally. What made it fourth from being the first is prevention. There was awareness on prevention, there was awareness on regular screening, there was awareness on examinations, and we know low-income countries are very prone to cervical cancer because they don't have enough awareness. So I want you to stay with us till the end of this talk, because I know you'll be gaining a lot. Cervical cancer, from the name cervical, is from the cervix. I said earlier that women are unique. Their reproductive system makes them unique, which is why in the reproductive system there's something we call the uterus. The uterus is the womb of the woman, where the fetus grows. We know when a woman is pregnant, that thing that makes the baby grow is called the uterus, and the cervix is part of the uterus. So cervical cancer is when there is cancer of the cervix. And if we say cancer, what does cancer mean? Cancer is the abnormal cells that grow. Like the illustration I like to give anytime anybody asks me about cancer is, if a normal cervix is supposed to have 10 cells, but in cancer, that means cervical cancer, the cervix is having like 1,000,000 cells, is having 1,000,000,000,000 cells. That means there's multiplication of cells that are supposed to be 10. For example, cells that are supposed to be 10 in cervical cancer, the cells are 100, they are 1,000, they are 1,000,000, they are they are proliferating. Medically, we call this proliferation of cells in the cervix. That's the multiplication of cells in the cervix. So this cervical cancer is in two ways. It can be benign, is what medical we call benign, and then malignant. The benign means that it is a growth, but it is not harmful. That means it is confined to the cervix, it does not spread outside the cervix. But malignant means that it is a growth, but it is harmful. It spreads. It can spread past the cervix to the uterus. It can spread to the vagina. It can spread around, and that is the harmful one. That is what is killing women now. And take note that even the benign that I'm talking about that is harmless, it can grow to become malignant. That is why we need this awareness. That is why early detection and regular screening is very vital. Cervical cancer is mainly caused by HPV infection, which means human papilloma virus. It is not the only cause of cervical cancer. It is closely associated with cervical cancer. Actually, it is an STD, a sexually transmitted disease, but there are strains of it, precisely 16 and 18, that are closely associated with cervical cancer. So if a person or a woman has HPV infection, that's human papilloma virus infection, the woman is at risk of having cervical cancer. And not just that, she has, because some people have HPV and it does not harm them, like they won't have anything. But some people have it, that's persistent HPV over time, and it harms them. It causes cervical cancer. And take note, not only women have this infection, men also have this infection. But we'll be coming back to that. So who is at risk of cervical cancer? Who is at risk? How will I know that I am at risk of this cancer? The first one is women of childbearing age. Women of childbearing age from 15 to 49 are at risk of cervical cancer. And the reason why women of childbearing age are at risk of cervical cancer is because they are exposed to sexual activities already. And one of the major risk factors for cervical cancer is sexual activity, early sexual activity, and having multiple partners, multiple sexual partners. The second one is even younger girls exposed early. That's, if you noted at the beginning, I said this is not just for women, because the age we are now, even girls of 8, of 9, of 10, they are involving in sexual activities, which is very early for them. So younger girls exposed early are at risk of cervical cancer. The third one is risk increases with multiple partners, early sexual activity, or weak immunity. So women that have multiple partners, because you cannot even trace it. You sleep with A, you sleep with B, you sleep with C, you sleep with D. You don't know what A has, you don't know what B has, you don't know what C has. A can have HIV, B can have HPV, different infections flying around there. So your risk increases when you have multiple sexual partners. Then early sexual activity is also a risk. Weak immunity is a risk. Infections generally, not only HPV, infections generally, whether bacterial, virus, fungi. When a person has weak immunity, a person is susceptible to such infections. Women with HIV, we call them immunocompromised patients, people that the conditions they have, they're harboring, is causing weak immunity. That's like HIV, like arthritis, rheumatoid arthritis. Conditions like that make one susceptible to infections, HPV infection. Then ignorance, people that are at risk of cervical cancer, there are people that are ignorant because they don't know what can cause it. You don't know who is at risk. You don't know anything about it. So you're just living your life there. You don't know what is wrong, what you can have, and how harmful it is. So one of the risks of cervical cancer is ignorant. So why should women care about why are we bringing this awareness to us? Cervical cancer affects fertility, family, and emotional health. It affects fertility depending on the stage. One thing about cancer is that it does not show early. It shows no symptoms early. But when it starts showing symptoms, when it has it is already progressing aggressively, that is when you notice it is when things have gone really bad. So cervical cancer affects fertility. I mentioned earlier that cervix is part of the uterus, which is part of the reproductive system. And we know that the reproductive system is where women produce life. And if there's a problem wrong with any part of the reproductive system, we know it can affect fertility. Cervical cancer affects the family. Emotional health of the family also is affected, because if a mother is affected, if a sister is affected, if a wife is affected, the family will not be able to balance their life the way it should be. So it affects their family and emotional health. It takes away mothers, it takes away sisters, wives, women that bring the family together. Prevention equals protection of generations. If you can prevent cervical cancer now, you are protecting your generation, because once you can prevent it on yourself, you have reduced the risk of your daughter having cervical cancer. If your daughter also prevents it, she has reduced the risk of her children also having cervical cancer. So if you can prevent it now, you've protected your generation for life. So the next outline is the symptoms and warning signs of cervical cancer. And the first one is unusual vaginal bleeding. When a woman notices that she has unusual vaginal bleeding, especially after intercourse, it can be a symptom, a warning sign of cervical cancer. I'm not saying if you have any unusual vaginal bleeding now, it is cervical cancer. If you have an unusual vaginal bleeding, go to the hospital for examination. See the doctor for more clarity on your health status. The second one is pelvic pain or foul smelling discharge. Our uterus, our reproductive system, is located in our pelvic, the hip bone. So it's located in the pelvic. So there will be pain if, as I said earlier, that cancer, there are abnormal cells that grow. So they cause pain, and they will discharge from the site of the cancer, which causes foul smelling discharge. So if you notice pelvic pain, you notice foul smelling discharge, it can be a symptom of cervical cancer. Another symptom is pain during sex. When you feel pain during sex, is also a symptom of cervical cancer. And often no symptoms in early stages. Cancer is like an uninvited guest. It does not show symptoms. Sometimes at the early stages, like this stage 1, sometimes even to stage 2, it does not show symptoms. The only time you will just know is that it has gone so big, and then they are diagnosing the person with stage 3 cancer. So there are often no symptoms in early stages. Some people might not even know that they are harboring it already. And this is why screening is very vital. You never know what is growing already, because we cannot see inside us. So screening is very vital. Regular examination is very vital. So stay with me to the end, because I will still be laying more emphasis on screening and prevention. So the causes and risk factors: persistent HPV infection. As I said earlier, multiple sexual partners. She keeps having exposure to HPV without treating them. The woman can have cervical cancer. It's a cause of cervical cancer. The second one is early sexual activity. When a child of 9, 8, 11, 12, 13, 14 are engaging in sexual activity at such an early age, they are prone to cervical cancer. It's not because of the activity, but because of the infections they can be getting from those partners. The third one is multiple sexual partners. The fourth one is smoking and poor genital hygiene. Any unhealthy habits can cause cancer. From smoking, alcohol, they can cause cancer, because smoking affects immunity of the body. If there's reduced immunity, any infection can just come into the body. Then poor genital hygiene. When the woman does not take care of her genitals well, it can cause cervical cancer. Lack of regular screening. There are time frames for regular screening, from pap smear to HPV test, DNA testing, VIA. There are time frames, and when women don't screen themselves regularly, it can cause cervical, because you don't know what is growing. It's through this screening that you will know that, oh, you have this, okay, watch out for this. That is how you can know. We are moving now to the prevention and screening of cervical cancer. I'll be laying more emphasis on this part. The first prevention, the only way to prevent, apart from healthy lifestyles, that's exercise, right nutrition, eating good food, living healthy. Apart from them, the main prevention of cervical cancer is HPV vaccination. That's human papilloma virus vaccination. And this HPV, they are in different phases. So public health nurses do campaign on HPV vaccination for girls from age 9 to 14. They go around communities and give free vaccinations to them. So HPV vaccination is important for the prevention of cervical cancer for age 9 to 14, and it's also for boys. Men can carry HPV infection. It's just that they don't have cervix to have cervical cancer, but they can pass it to girls, ladies or girls that can have the infection of the cancer. So HPV infection for girls 9 to 14 years, you have 2 doses for them. But they can be 6 to 12 months apart. Then for 15 to 26 years, the first batch I said 9 to 14 years, you ensure that it's before sexual exposure. It is very effective if the person has not engaged in any sexual activity. And also from age 15 to 26, they have 3 doses. It may be 3 doses, it can still be the 2 doses, the normal 2 doses, but it can also be 3 doses, and is more effective for them also if it is before sexual exposure. And it can also be given to adults. It's just that it will be less effective for them than those that are taking it earlier on before sexual exposure. So that's HPV vaccination. You can just walk into any primary health center. They always have the vaccine ready for. I don't know it will be free, but they always have vaccination for people, for girls, for women. The second one is regular pap smear and HPV testing. It's like an examination that will be done. They will inspect the genitals, then they will use an instrument to visualize the cervix, because the cervix is inside, so they have to use an instrument to visualize inside. So pap smear is done to detect abnormal cells from normal cells. I said earlier that cancers are abnormal cells. So pap smear helps to detect abnormal cells from normal cells. And this is the first test they used to do when it comes to cervical cancer. You get pap smear, because that's the first test. Not that it is the primary screening method. There are other screening methods, but it is the first one, because if pap smear shows an unusual result, that is when other screenings are done. But the first thing they do is pap smear. And how is pap smear done? They will just take a specimen from the cervix, and then it is taken to the lab to be examined. Then if the result shows negative, like result shows good cervical cells, the woman is free, and then she can come back in the next 3 years. The time frame for pap smear is 3 years. But if the pap smear shows an unusual result, that means there is a problem somewhere. Sometimes when pap smear results are unusual, it does not necessarily mean the woman already has cancer, but they just try to treat the woman. They will check for other things that can cause the abnormal result. If it is HPV infection, they try to treat the infection. Whatever can cause it, they treat the woman, and then they tell her to come back in 3 months' time for a repeat pap smear. That's if the pap smear is unusual, is like abnormal result, or they notice something wrong somewhere. She comes back in 3 months to check again. Once she comes back and the result is normal, she's free to go. She'll come back in 3 years' time. But if she comes back and the result stays the same, she will then go for the next screening, which is called colposcopy. It is more effective. Pap smear is just like normal test that they will just quickly do. But colposcopy is one that they visualize the cervix. They check for unusual cells. When they visualize the cervix, if a woman has cervical cancer, there are white plaques on the cervix. So it's one of the things we note. And also, if we are trying to inspect with a spatula or a specimen brush, and the place is bleeding, like if we touch it and it's bleeding, we know that there's something wrong also. We note that down. Not to bore us with medical terms, colposcopy is just the advanced testing for cervical cancer. If pap smear proves abnormal, that's where the nurses come in for emotional care, because it is really not easy for a newly diagnosed patient from fear to difficulty, like how will they balance their responsibilities? Their children depend on them, their husbands depend on them. That's where nurses come in, emotional care. We take care of the patient, we counsel them. Usually we assess their mental health, then refer some, and some just take care of them ourselves. So, and difficulty with coping with the diagnosis too can be very difficult. For somebody living a type of life before, suddenly you are going to have to change and everything. So that is where the nurses come in. So that is just all about pap smear. And HPV testing. HPV testing is done every 5 years. Screening for cervical cancer starts from age 21, from age 21 to 65. Pap smear is done every 3 years. If you do it now in 2025, you are going back 2028. And HPV DNA testing, that one is what doctors do for you to know if you have HPV in your DNA. That is, it is genetic. That one is every 5 years. And I forgot to mention earlier that a person can have HPV infection now and nothing will happen to the person. This disease grows 15 to 20 years, about 15 to 20 years. That's what it takes for this disease, this cancer to develop. So that's why they said the age group that usually have cervical cancer is from 35 to 55, around that age, because it doesn't come immediately, it comes. It develops, it's gradual. You will not know that anything is happening, you will not know that anything is growing, but then suddenly it will just come. That's when the symptoms will show, which is the reason for regular screening. That's when the health practitioners will be able to tell you that, okay, this is what we notice, this is what we notice. And if you are fine, they will also tell you you are fine. But if you detect every 3 years, I said earlier that the disease develops 15 to 20 years. So in between those 15 to 20 years, if a woman is doing regular screening, regular examinations, it should have been detected. And I said earlier that if it is detected early, it is curable. It will be easily cured or prevented from happening. So another prevention is safe sexual practices. Safe sexual practices involves the use of barrier contraceptives like condoms, diaphragms, female condoms. Those are barrier contraceptives because they prevent STDs. Then avoid smoking and maintain hygiene. Then the treatment for cervical cancer, the treatment depends on the stage. Any cancer apart from cervical cancer, any other cancer, treatment depends on the stage. The treatment depends on when they discovered it, that okay, this person has cancer, what are we going to do? So for cervical cancer, there are 4 stages. Stage 1 is when the cancer is confined to the cervix. Stage 2 is when the cancer is spreading, not it has not gone far, it's still around the cervix, maybe to the uterus, or is invading the cervix well now. At stage 1 can just maybe just a little grunt. Then stage 2, it is invading the cervix. Stage 3, it is already moving to the close by organs, uterus, the vagina. Stage 4 is when it's metastatized. That is the medical term for the spreading of cancer. It can move to the lungs, it can move to the rectum, it can move anywhere. So the treatment depends on the stage. If it's in the early stage, you can just perform the surgery to remove the part of the cervix that is affected, or cryotherapy. Cryotherapy is a freezing therapy where they freeze the cancer or the growth with nitrous oxide to remove it. If the person that develops the cancer is a woman that has given birth, like she has had all her children that she wants to have, they can just advise her to remove, like hysterectomy, that's removal of the uterus. Or just if it is very bad, they might advise her to just remove the fallopian tube to prevent the reoccurrence of the cancer. And if it's advanced stages, that's when you go for radiotherapy, chemotherapy, immunotherapy. So early detection saves the cervix, the womb and life. For a person, or if it's a young lady that has cancer, if it's a woman that has not given birth, or woman still giving birth that has the cancer, it is very early detection saves the cervix, because when you detect it early, they don't have to remove anything. Even if they want to remove, it's just going to be small. It preserves the cervix, preserves the womb, and it preserves the life of the woman. So the role of women and community, every woman should know her health status. Every woman should know her health status, know your health condition, know what you are prone to, know the conditions that are hereditary, know your status. The second one is encourage daughters, sisters and friends to get screened. Don't just listen to this message for yourself, forward these others to listen to, so they can also be aware. Encourage your daughters, your sisters, your friends to get screened. The third one is break the silence. Talk about cervical cancer openly. It is not something to hide. It's something we should talk about openly. We should create awareness about cervical cancer. I remember one time when I was in an hospital, and then a group of women came. It was later on we knew they were teachers. They came and they were like, their boss told them that if they did not come for pap smear, that is going to lay them off, like he's going to sack them. And I was really impressed that wow, that so they still take that. For that boss, that means cervical cancer, maybe who knows, he knows the importance of awareness, because they were really serious that if they don't do it today, their boss is going to scold them. So I was really impressed with that scenario, that wow. And even they when we asked them, they were speaking freely, they understood what they came for. And it's really, that's one part of awareness. So the community should create awareness, government should create awareness, women too should create awareness for themselves. Then empowerment. Cervical cancer is not a death sentence. It is not a death sentence. It's, as I said earlier, if detected early, it is curable. And even if it is not detected early, it's not a death sentence. It can be managed. Awareness, love and regular screening saves lives. Awareness, as I've been saying earlier, regular screening saves lives. Every woman is precious. Your body deserves care and respect. I don't want us to be ignorant or just think that I will drink agbo or you drink one herbal. Okay, I was also passing one day, and then on the road one man was just broadcasting that he's selling a drink, one herbal drink, that drink cures cancer. It cures. In my mind I'm like, and this man, and some people will really go there to go and buy this drink that they want to cure their cancer. We should go to the hospital. If you notice anything unusual, go for screenings, go to the hospital, because some people will buy that now. If at all it cures their cancer, which I don't think it will cause a lot of other problems, for liver problems, kidney problems. Even if they end up, I don't think it will cure their cancer, but even if it cures the cancer, it will bring other problems for them, like kidney problems, liver problems. So women, your body deserves respect and care, and you should take care of your body. Go for regular screenings. Early detection saves lives. Call to action: your health is your strength. Get screened, get vaccinated, speak up. Let's not be shy. Let's not cover up something that should be open. There's one Yoruba adage that says itiju mafi tiju karun. Don't use shame and then have disease. Yes, ma'am. Mafi tiju karun. So we should ensure that we speak up, get screened, get vaccinated. And if you notice anything wrong with you, don't be scared. They will look, your community will look down on you. Speak up. Let's protect the beauty, power and uniqueness of womanhood. So thank you for listening. That's the end of my short presentation. Thank you.
Thank you so much.
Thank
That
you.
is not short. It's quite impressive, honestly. You covered lots of questions, areas of concerns, youth. This is actually very detailed, especially for a program like this. It's to create awareness, and your presentation today has been very expository, I must say. And I would just ask a few questions. And one that I would love to ask, and for the sake of our audience, is: can a virgin have HPV? Sorry if I'm mixing the terminologies, but you know what I'm talking about. Yeah, because you mentioned it in the course of your presentation. So is it possible for a virgin who has never had any sexual intercourse to develop such an infection? Yeah.
Okay, so for a virgin to have HPV infection, I would say the risk is very low, because HPV infection is a sexually transmitted disease. That means it's only when a woman has been going around multiple sexual partners, any sexual activities, that's when she can have it. But there are some unique circumstances for virgins to have such infections. It might not be that they actually performed the activity. It can be maybe through open skin, like other ways infections can be transmitted, but it is a very low risk for virgins to have HPV infection. It's very low.
Okay, thank you. Another thing that I know it's very common is shying from medicine, shying away from medical people. And I always tell people that the hospitals, they're there to help us. You know, ordinarily anybody gets nervous when you are on the way to the hospital. I'm not an hospital person myself, but somehow I live in a society where whether you like to go to the hospital or you don't, your doctor is going to call you to come and do the proper examination. So, I might
Oh,
count myself as lucky. But I discovered that for those of us who live in developing countries, the workplace sometimes do organize, sometimes the workplace do not. You raised a very good example of the group that came and their boss. Only God knows how the boss has so much awareness of cervical cancer, because it's what kills. It's what you've said it all. I don't want to repeat what you have said. It's what brings disaster to homes. Everything changes once there is an announcement of cancer. But one emphasis I will also want our audience as part of our take home from our guest today is, don't be shy. She's a professional. She's a nurse. She spoke like an authority, and she gave us this mind that you can walk to the hospital, go to a good hospital. Don't just go to somewhere at the back of your house or any quack hospital. Go to a registered hospital. Go to an hospital that you as the society knows about, and let them do a screening. And another take home is, if she said cervical cancer is not a death sentence, am I repeating what she said? And
yes, ma'am.
yeah, and she said that palm smear is the first stage. If, let's say, you go for a palm smear and it really shows that something is wrong, it's not the end of the world. Please, I want our audience to take note of all this, because it's very, very important. I like the way she talked about the nurses. I love nurses, because if you are a woman, you had better be a friend to nurses. The doctors are just going to spend a few minutes with you, and they're going to hand you over to the nurse to take care of you. So, especially if you are going to be childbearing, they had better be your friend, because you're going to be spending lots of time with them in childbearing and so many other things. So, is it possible, even like, can anybody just walk in, like, let's say you go to an hospital, can you speak to a nurse? Can you educate us? Is there a forum, even before we meet with the doctor? Is there a forum where we can just call a nurse, or is there a section that can deal with things like that? Sometimes people are just afraid. They are just fidgety. Maybe based on mental health. Is there a forum where they can speak to somebody first?
Okay, yes, ma'am. So I don't know if most hospitals have it, but the few hospitals I have gone to, they have a center, like a cancer center. But at first, when you get to an hospital, you go to the GOPD. Is at the GOPD, you tell them the problem, okay, this is what you want to do. and you the GOPD, your first contact is with the nurses. So once you tell them what you want, okay, if it's awareness you want, you need awareness on this, on this, on that. Or if you notice some symptoms from what I've said and you need awareness on them also, you need them to speak to you on it. They will speak to you and also refer you to the necessary people. If it's to go to the cancer center for more counseling, they will refer you there. If it's to see the doctor, they will refer you there. So yes, once you get to the hospital, there are people that just go to the outpatient department. From there, you'll be able to find your way to the necessary place to visit
Okay.
for that will cure your curiosity.
Thank you. Another question I would like to ask. Not everybody, not all fingers are equal. Some people run away from the hospital based on expenses, the cost. And that's why they take the alternative route. And you said that for those who take agbo and all that, herbal drinks and all that, that's not too good enough. Because the human being itself, the human anatomy. So the way why I appreciate medical doctors is I believe somebody or nurses is these people have spent many years studying to help us.
Yeah.
Why don't we go to them? So for those who take all these herbal drinks, it should not be your first place of contact. Go to the hospital. It's one of our emphasis in this foundation. We want to create an awareness. We want to make people know that if you need help, there are people who are willing, who are ready to help you. You only need to go to the right place. Have I said your mind as a professional? Yes.
Yes.
Oh,
they need to come.
Okay, and you nurses, you are there to welcome us. You are there to answer questions. Anything that looks strange, you are there to help. So the nurses, the doctors, the medical doctors, they are all there to help. Please, let's make use of what we have. Before I don't want to hold you for too long because we can't answer all the questions. I'm just trying to pick up imaginary questions that people may have on their mind. One last one. When you said men do have this, because I believe the men folk too are gaining from this, do they have to go through the same process, or what do they do as a man? What can a man do or men do? Yeah.
So for men, they don't have a cervix, so they cannot have cervical cancer.
Okay.
The only reason why we want men to be vaccinated is to protect the ladies, the girls, because if men are vaccinated from HPV infection, that means they cannot have the infection. And if they don't have the infection, ladies most likely cannot get it from them. So that is why we want boys, it's actually boys, 9 to 14 years boys, to have the vaccine so that they cannot develop the infection. So even if anything happens, they cannot transfer the infection to the girls. And also another important that you just struck in my mind is for the place of men in cervical cancer awareness. You can help your sisters, you can help your wives, you can help your mothers. Let's not push them out. Let's not put them alone that it's your business, it's your disease, your cancer, it's not my business, something like that. Let us encourage them. Let us also help them create the awareness wherever you go to. Also, I think that's another place for men.
Thank you so much. I'm not going to hold you any longer. You've really done a very good job. Thank you so much. I know some of our audience would have questions. So in the comment section, would always ask you to please help us answer those questions when they come. And if there is any need for elaborate for an expansion, definitely, if you don't mind, Auntie Praise, we're going to bring you back. Thank you so much for today. We wish you well. Thank you for coming. Bye.
Thank you. Bye, ma.
Bye.